Did you know that colorectal cancer is one of the most common cancers in the United States? Well, joining us this morning is Dr. Stephen Barone of General Physician PC and UBMD Surgery, and we're going to chat about some of the signs and symptoms of this type of cancer and how we can prevent it. Good morning to you, Dr. Barone. How you doing?
Good morning. Thanks for having me.
Yeah, it is so nice to see you this morning. Of course, we're talking about colon cancer, but it is Colorectal Cancer Awareness Month. What can you talk to us about this month and how we can prevent this type of cancer?
Well, colon and rectal cancer often presents with no symptoms at all, but when there are symptoms, they're sometimes pretty nonspecific, like vague abdominal pain. It can vary in intensity and type of pain or location. Sometimes people experience a change in their bowel habits, whether it's the frequency, the consistency, the size or the shape of their stools. Oftentimes people have rectal bleeding, and that can also vary in intensity and in the color of the blood. Sometimes people have bleeding that's bright red. They think it's just hemorrhoids, but any bleeding at any age really needs to be investigated.
Is there anything that we can do from day to day to avoid this from happening?
Well, there's some risk factors for colon cancer that we can't control. First off, like our advanced age, family histories of cancer and of polyps, and personal history of inflammatory bowel disease such as Crohn's or ulcerative colitis. Now that's different than IBS, which is irritable bowel syndrome. That does not carry a higher risk.
Okay.
But risk factors that we can't control are obesity, sedentary lifestyle, diets high in red meats and other processed meats tend to raise the risk, and heavy alcohol use and smoking also raise the risk.
All right. Now, at what age should we start screening for this?
For the average person with, average risk, no family history, no symptoms of bleeding, we start at age 50. Okay. For people with family history of cancer or polyps, advanced polyps, we start at age 40 or 10 years earlier than their family members affected.
Screening, we're talking about colonoscopies, something that a lot of people don't like to think about. It has a bad rep, right? But it's not as bad as you think.
That's true. It's the gold standard for screening. The benefits of it are that we can detect polyps at a small size before they may progress into cancer. We can even find cancer at an earlier stage where it's more curable. So screening with colonoscopy can reduce both the incidence of colon cancer as well as the mortality from colon cancer. And the prep's a little unpleasant. No one loves it, but it's a necessary evil because the colon needs to be clean, so it's effective.
Something you got to do, right?
Unfortunately, yes.
Yeah. So talk to us about colonoscopy in general. How long is this going to take?
The procedure itself averages about a half an hour, from the time in the room to the time out of the room. Some people do experience some discomfort, but we sedate you with moderate sedation to make it very manageable. Most people don't even remember anything when it's over.
Mm-hmm. So it really doesn't hurt?
Not really, no.
No. And you wake up and you're all ready to go home. Now, for Western New Yorkers who are tuning in this morning, what do you want them to know about your practice in general?
Myself and my partners, we do colonoscopies and colorectal surgery throughout the Catholics and the Kaleida facilities, and it's very important to get screened and find these cancers early.
All right, sounds good. Dr. Barone, thank you so much for joining us here this morning. We'll let you get back to work.
Thank you for having me.